Hi there. Welcome to Animity 1D. My name is Lisa. I am a diabetes educator and also have type 1.
My name is Alex. My son Miguel has type 1.
And my name is Matt, another diabetes educator. In this video, we go over what to do when you are sick with high sugars and have ketones. Please remember that this is for educational purposes only and is not meant to replace your doctor or care team. Thank you.
Hi, Alex. Hi, Miguel. I want you to meet Matt. He is a diabetes educator who just joined our team. He will be teaching the sick day class for you. I am here to help if he needs it.
Hi, Alex. Hi, Miguel. Nice to meet you both.
Matt, nice to meet you too.
Today, we will go over what to do when Miguel is sick and has high sugars and ketones. I'll let Matt take over.
Sounds good. Thanks, Alex. Let's start with what do we mean by sick days? This refers to any situation that increases Miguel's risk for forming ketones. That usually happens when his body has high energy needs and starts breaking down fat, which is a backup energy source. In these situations, you should check him for ketones.
How do I identify these situations?
You should check Miguel for ketones in these instances. If his blood sugar is more than 250 milligrams per deciliter or 13.8 millimole per liter, twice in a row or for over 3 hours. If he has nausea, vomiting, stomach pain, fever, or has any illness, regardless of his blood sugar. Or if he's going to exercise but his blood sugar is greater than 250.
How does Dad test me for ketones? Is it by poking my finger like a blood sugar check?
Miguel, there are 2 ways to check for ketones. Ketones can be checked in the blood like how we check a blood sugar, using a blood ketone meter. It can also be checked in the urine using ketone strips. Both have their pros and cons, but the main thing is to remember to check for ketones and have one of these options always available.
How do I interpret the results?
Alex, remember we spoke about this earlier? Here is a chart that compares blood and urine ketone levels. Large urine ketones and a blood ketone above 3 is high risk for DKA. When treating, we aim for a blood ketone of less than 0.6 or negative urine ketones.
Got it. Now I know when and how to check Miguel for ketones. How often do I check for them?
For blood ketones, you check every 2 to 3 hours. For urine ketones, every time he uses the bathroom.
How do I get rid of the ketones?
For that, we need to talk about the 4 pillars for managing sick days. 2 of these pillars are about intervention, namely insulin and fluids. The other 2 are about monitoring, mainly checking sugars and ketones. We already went over when, how, and how often to check for ketones. Let's go over why we need to check for them. When we are sick, our energy needs go up. To meet that need, stress hormones are released, which are like keys that release stored glucose. If we don't have enough stored glucose, then we use fat, which is a backup energy source. When we break down fat, we form ketones, which provides energy, but also makes us feel sick. As the ketone level rises, these symptoms can get worse, leading to DKA. That's why it is important to check them. Alex, to answer your question about getting rid of ketones, we do that by giving insulin. Insulin sends the glucose into the cells, so the body stops turning to fat for energy. So, insulin effectively stops new ketones from forming.
How do I know how much insulin I should give and how often?
Before we get into how much and how often, let's talk about how specifically to give insulin. Miguel is on injections now, so you just continue that. If he is on an insulin pump in the future, there are a few things to remember. When you're on an insulin pump, the basal portion is given as a steady drip of rapid-acting insulin by the pump. There is no separate long-acting insulin injection. So a small kink in the tubing or a blocked site can stop insulin delivery, and very quickly, he can start forming ketones. So, with an insulin pump, there are some extra steps. Change the infusion site. When in doubt, change it out. Give insulin as injections in the meantime. Don't use the pump. You may need to give extra for bolus and also increase his basal by 10 to 20%. And for the new closed-loop pumps, you could go to manual mode to give you more flexibility with managing the ketones. Now for how much insulin. When we are sick, the stress hormones cause some insulin resistance. So, the usual insulin doses for high blood sugar correction are not enough, and you will need to add extra. How much extra depends on the ketone level. The higher the ketones, the more he needs. There are a few different ways of calculating this dose as shown here. You can calculate the high sugar correction dose and add 10% of that for small to moderate and 20% for moderate to large ketones. Another method involves calculating the total daily dose of insulin and giving 10% of that for small to moderate and 20% for moderate to large ketones. Blood ketones of 3 or higher, or large urine ketones indicate a high risk for DKA. In that case, if Miguel looks tired, is vomiting, or you are not comfortable treating him at home, call us immediately. He may need to go to the hospital.
This sounds a little complicated. Do I have to do this myself?
We will help you with that. We will go over it before you leave today, and at his clinic visits, we will keep updating his doses.
How often should I give him insulin?
Rapid-acting insulin is given every 2 to 3 hours based on how high the ketones are.
How do I know if it's working? I am guessing I need to monitor his sugars?
That's right. You check Miguel's blood sugar every 2 to 3 hours to sync it with his insulin dosing times. Try to keep the blood sugar between 70 to 180 milligrams per deciliter, which is 3.9 to 10 millimole per liter.
Does Dad have to poke my finger every time to check my blood sugar?
No, Miguel. He can use your continuous glucose sensor too. So far, we covered ketones, insulin, and blood sugar monitoring. The last pillar of sick day management is fluids. Fluids are important because our body flushes out ketones in the urine. So, Miguel needs to drink fluids to get rid of the ketones and to stay hydrated. The insulin stops new ketones from forming, and the fluids flush out the ones that are already there. Together, they get rid of the ketones and turn things around.
Miguel's sugars will be high, so what fluids can I give him to drink?
If his sugars are above 200 milligram per deciliter or 11 millimole per liter, you should give him fluids without carbs. Water is an easy option, but he needs electrolytes, so also try sugar-free sports drinks like Zero Sugar Gatorade and Powerade Zero. Other options are oral rehydration drinks like Pedialyte, diet soda, and soup broth. Sometimes, his blood sugar may start responding faster than the ketones. If his sugars fall below 180 to 200 milligram per deciliter, which is 11 millimoles per liter, but he still has ketones, then switch to carb-containing fluids so you can give him insulin safely.
How much fluids do I give him?
Taking sips of fluids is easier on the body than drinking a large amount at a time. Cooler fluids tend to be better too. One tip is half to 1 ounce every 15 minutes. Another is 4 to 6 milliliters per kilogram per hour. As you do all this, you should also talk to Miguel's pediatrician so they can help with the illness itself.
So, if Miguel is sick, who should I call first? His pediatrician or you?
You should call both. We will help with his diabetes sick day management, but to find out what is going on, you will need his pediatrician's help.
Matt, well done. Let's recap everything one more time.
Sure. Alex, you need to check Miguel for ketones in the situations outlined here. If he is on an insulin pump, follow these steps next. After that, management centers around these 4 pillars. Monitoring blood sugars, ketones, and giving fluids are very similar for all ketone levels. The insulin dosing is the main step that is different, as you can see here. Remember, if urine ketones are large or blood ketones are 3 or more, watch him closely.
If he keeps vomiting and can't keep fluids down, looks tired, starts breathing hard, or you are not able to continue managing him at home, then you should take him to the hospital.
Thank you, Matt and Lisa, for explaining sick day management. I will have to go over this a couple of times, but it makes more sense now.
Sounds good. Let's go over Miguel's ketone doses and then we're done. We hope this gave you a better understanding of how to manage ketones with high blood sugars.
Please remember that this is for informational purposes only and is not meant to replace your doctor or care team.
Don't forget to like and subscribe to our channel. Thank you.